I'm Dr. David Johnson. I'm a gastroenterologist with Kootenai Health in Coeur d'Alene, Idaho. I'm the medical director of gastroenterology and endoscopy services. So here in North Idaho, we take care of patients all the way from the Canadian border down to central Idaho, and that encompasses a really big rural population. And coverage can be an issue. These are working people who may not always have commercial health insurance, and trying to make sure those people get the care they need is really important.
I'm Nancy Wadamy. I am the patient navigator. I work for the Shoshone-Bannock tribe in Fort Hall, Idaho. We don't have an oncologist that provides services in our clinic. So if somebody is eligible for Medicaid, then their access to care opens up quite a bit. That is really a godsend for them to receiving their cancer care.
I'm Patrick Murillo, and I'm a member of the Shoshone-Bannock tribe, Fort Hall, Idaho, and I'm currently residing in Pocatello, Idaho. I'm a two-time survivor of prostate cancer. Having Medicaid and having that tool to be able to fight the reoccurring cancer was phenomenal. It brings you more comfort than you can imagine because you don't have to worry about that medical debt. We would all be in debt if it wasn't for Medicaid.
I'm John Barnes from Boise, Idaho. I'm currently living at a sober living house. It's called Just for Today. I'm part of the house leadership there. I've been a lifelong addict. I started using drugs when I was probably 11 or 12 years old. I was in a dark place when I moved into that house, and because of Medicaid, I was able to stay there.
The costs were extraordinary. I mean, you enter that operating room and you see a team of surgeons, as well as staff, and at that point you realize they are helping you cure cancer. You're pretty amazed that the technology is there to actually give me a second chance at life. Without Medicaid, I don't think I would have had a very good chance otherwise.
So through the Medicaid expansion, our cancer patients have had a lot more opportunities to receive care that they probably wouldn't have if they didn't have any insurance. My patients, especially if it's a cancer that they can't treat locally, they have a Medicaid transportation piece, and so it really covers holistically the patient.
Without the help of Medicaid, I would have been basically homeless and probably not sober. I'm finally in a position in my life where I can help other people, and it's a really good feeling. I have a part-time job at Home Depot. I get about 16 hours a week. It's given me the opportunity to focus on my recovery and those aspects of my life. Going to college in Western Idaho, studying studio art, trying to get my associate's degree, and I'm on the president's list, which is a pretty big accomplishment for me. Medicaid made it possible for all that to happen. I got pretty sick in May. I had a blockage in my intestine, and it got really bad. The tests that they did, there's just no way I could have paid for that. The bills for them were just like astronomical. I wouldn't have been all right without them. I would have been sicker, possibly not even here. It's wonderful to have Medicaid lift that burden. It just keeps us on our feet, and it helps us to help the next guy. That's the biggest thing, because watching another guy make it is one of the best feelings in the world.
I think the Medicaid expansion is just an amazing opportunity for all of Idahoans. My personal experience as a patient navigator is that it's really beneficial for people who didn't have insurance and are able to qualify for Medicaid, so they don't have to stress about how they're going to pay for their cancer care.
I think it's very important for people to get Medicaid and be able to qualify for the expansion program. Once you find out you have cancer, you realize how expensive it is, and the costs are astronomical.
So access to screening is overwhelmingly important. We know that since the guidelines changed to include all the way down to age 45 for colorectal cancer screening, that the compliance in being up to date with screening is only about 20%, and access and costs is part of the reason why that's not higher. The goal is really to have 80% of eligible patients screened, and Medicaid is an important tool for patients to be able to access that care that they need. We know that patients in rural regions that have poorer access to care or less insurance coverage are more likely to be diagnosed with cancer, and they have a shorter survival than patients who have commercial insurance. I see patients not infrequently who are working 2 and 3 jobs who are struggling to afford their care, their medications, and so we think about those things, and it's absolutely crippling when you're trying to take care of folks and you just can't get over that financial piece because there are barriers to them getting the care they need.
I was asked to speak to a committee at the State House on Medicaid expansion. It was a little bit scary, a little bit intimidating, but I felt like it needed to be said, and I hope it helped. I think it's important for the community. A lot of these families here in Boise don't have the money or the means to get the health care that they need. It just seems like the people that can get on Medicaid have a better shot at changing their life.
I just want to thank all of the Idaho lawmakers who have supported this Medicaid expansion. Without it, there's a lot of Idahoans, especially the people I work with that have cancer, that wouldn't be able to have insurance coverage. There's so many benefits through Medicaid that make that cancer journey easier on those patients.
To diagnose an early stage cancer and to effectively treat that patient costs about half as much as a late stage diagnosis. And from a societal standpoint, we don't have an ability to impact our neighbors' health directly, but we do have an ability to impact our neighbors' access to health care in certain situations. It keeps people in the workforce, it keeps people at home, keeps people alive.
Medicaid, definitely helped save my life. I mean, there's no doubt in my mind. I think Medicaid was an investment in me, and it gives me the opportunity to help other people. I want to be a productive citizen, and I just really want to give it back.
I'm very positive, and that second chance was everything, because I believe Medicaid saved my life. As far as they're saying now, I'm in remission and things are good. So yeah, I do believe it gave me the best chance of survival, and that allows me to have a second chance of life.